Hello all, today we are going to talk about the topic pulmonary contusion. Okay, so what is pulmonary contusion? Uh, it is a injury to the lung parenchyma. So it lead to edema. Okay, injury lead to edema and blood may be accumulate in the spaces, alveolar spaces. Okay, and also it lead to changes in structure. Okay, structure and function of the lung. Okay, this injury happened due to the blunt trauma. So it is often associated with explosion injuries as well as the shock wave penetrating trauma. So the force, okay, blunt thoracic trauma, okay, is produced. So this force is transmitted to the lung parenchyma. Okay, so then it causes the pulmonary contusion. So it going to lead to the edema, blood accumulation, and hemorrhage in the lung tissues and all. Okay, what is the pathophysiology of the lung contusion? Let's discuss about it. So first, after injury, there is a bleeding and edema. Okay. After that, consolidation. So consolidation means becoming one thing. Okay. So many things becoming one thing, or becoming a solid, like that meaning outcome. Okay. The lung become consolidated and lung become collapsed. Okay. Then it lead to ventilation and perfusion mismatch. Then pulmonary hypoxic vasoconstriction, which means the lung getting low oxygen. Okay, so it lead to vasoconstriction. Okay, and also vasoresistance is also there. Sometimes, if it is severe, the fluid in the alveoli become a cannot getting O2. Okay, even if you give the supplemental oxygen, the fluids in the alveoli does not getting the O2. Okay, so it becomes a bigger problem. Okay, it is in the severe cases. Okay, then come to the clinical presentation. Okay, every patient having different types of respiratory difficulty. Okay, so if the person having the pulmonary contusion, then the person compulsory having the respiratory difficulties. Okay, so it include respiratory distress, coughing up blood or bloody sputum. Okay, so the blood will come when we cough. Then bronchoria. Bronchoria means production of watery sputum. Okay, that is a bronchoria. And wheezing. Okay, some person may feel the wheezing, the problem of the respiration. Okay, so this may occur. Then signs. These are all the symptoms we can see, but signs like dyspnea, the person having difficulty in breathing, tachypnea, okay, tachycardia, and hypotension, and some person having ecchymosis. Ecchymosis is a medical term for the bruise. Okay, so there is a bruise outside the body like that we can see. Okay, so these are all the clinical presentation of the pulmonary contusion. Then come to investigations. uh, Chest X-ray is the most important investigation method. Okay, so in this we can see the consolidation. Okay, but we can't localize the lobar and the segmental pattern. But we can see somewhat is a confusion like that we can analyze in this chest X-ray and CT. Okay, it is a most sensitive scan. Okay, so unlike X-ray, CT scanning can detect the contusion almost. Okay, so immediately after the injury, okay, we can take a CT and we can check for the pulmonary contusion. Okay, so by this we can determine the size of the contusion also. Okay, two-person Wagner and Miller. Okay, Wagner and Miller. So they determined the pulmonary condition and they divided this into the three based on the size. Okay, if it is 80 less than 80%, then it is a mild pulmonary condition. If it is 80 to 28%, then it is moderate condition, moderate pulmonary condition. Okay, if it is more than 28 percentage, I think so more than 28 percentage, then it is a severe pulmonary condition, contusion. Okay, like that the Wagner and Miller is just classified, determined. Okay. Okay, here you can notice the pulmonary contusion. Okay, so there is a link. Okay, um, the city, you can see the pulmonary condition. Note the red arrow. Okay, okay, the ribs get fractured, it lead to the uh, leakage of the pulmonary content. The pleura is not there. Okay, we can notice that. That is a pulmonary condition. Okay, then come to the management. Okay, the primary treatment is a supportive treatment. Okay, so we are going for the diagnosis. Okay, and we can give the supplemental oxygen. Okay, so it is going to treat the basic hypoxia. And if the person having significant hypoxia, that is partial pressure of oxygen is 65 mmHg, then the SpO2 is less than sorry, it is less than 65 mmHg, then SpO2 is less than 90%, then the person should be intubated, which means any tube should be inserted by their mouth or the nose, and the person should get the ventilation within the first hour of injury. If it is get delayed, it may lead to the death. Okay, so within the first hour of injury, these two, intubation and the ventilation, should be provided to the patient. So the intubation leads to uh, the goal of it going to reduce the edema, and it improve the residual capacity of the lung. Okay, and also decrease the hypoxia. Okay, so for this we are giving the intubation, and we are giving the pressure. Okay, we have ventilation, pressure ventilator we can use. By this we can provide the positive pressure, expiratory pressure. Okay, these are all we can give. And one important thing, fluid resuscitation. Okay, so this also be the care. Okay, because there is a contusion, means the lung parenchyma is just there. Okay, and the content of the alveoli is just getting outward, so that fluid should be resuscitated. If the resuscitation is happen, there may be a chance of hyperolemia, the volume may be increased, or hypovolemia, the volume may be decreased. Okay, so current standard of care is the maintenance of the euvolemia. So euvolemia means a normal volume. Okay, it not be the hypo or hyper. Euvolemia means normal volume. So that maintenance is a standard of care. Okay, and we are giving other supportive care also. Okay, that is a pain control. Okay, and pulmonary toilet. So the toilet used for the suctioning, okay, and coughing, deep breathing, and all. Okay, so the person having the lung problem, the lung may produce some of the extra fluids and all. So that are all getting suction, and the coughing content, sputum content can also getting by this. Okay, and other therapies like chest physiotherapy you can provide. In this, they give the chest physiotherapy and percussion. So percussion means they are just giving the forces on the chest. Okay, and optimal positioning. Okay, so to maintain the good lung. Okay, so we should have the good positions and all. Okay, then come to the complication. If it is untreated, then it lead to respiratory distress syndrome. Okay, adult respiratory distress syndrome. It may be up to 38% of patients having this. Okay, respiratory distress syndrome, and some persons may have the pneumonia. Okay, so the person can't able to clear the bacteria and clear the secretion. Okay, so increasing risk of the infections are there for, okay, for that person. Okay, up to 50% of patient tend to develop a bacterial infection. Okay, then come to the prognosis. Most problem resolved in 5 to 7 days. Okay, the contusion is recovered. Okay, so decreased functional residual capacity, which means the residual capacity of the lung is remains decreased for at least 6 years after injury. Okay, so for on that period the person should not have the have the pressure, should not have any forced deep breathing, like that they should not have. Okay, and it reduced the compliance of the lung. Okay, so the compliance permanently lost in the lung. Okay, so compliance means if we give force, the lung should going to be changes in volume change and all, but here the compliance is not there, so the lung can't able to change its volume and all. Okay, that is it becomes a permanent, the lung is become a hard, and the air only can change it. Okay, we can't change the nature of the lung, like that the compliance are developed. Okay, so larger contusion is having the risk also, increased risk. Okay guys, in this video we just discussed about the pulmonary contusion. Okay, in our further videos we are going to talk about more and more topics. Thanks for watching guys. Bye bye.